Hello and welcome to the Crux, where we speak to you about topics which are making the news and try to understand it, try to dejargonize it, and obviously bring you to the crux of every topic. Well, new year, new disease. The Guillain-Barré Syndrome has taken Pune by storm. To understand more about this disease, we have with us eminent virologist Dr. Shahid Jameel. He is also a fellow of Green Templeton College at Oxford. Dr. Jameel, thank you so much for joining us. And once again, we are grateful for your time and expertise.
Thank you for having me, Shatibra.
Well, the Guillain-Barré syndrome, as complicated and confusing as it sounds, its impact, of course, is pretty much caused quite a tizzy in Pune, Maharashtra. If you can help us kind of simplify and understand a bit about GBS.
Yeah, besides being an absolutely unpronounceable name, it's a fairly uncommon disease. Um, Usually, this is something that happens rarely following either a gastrointestinal infection, which means an infection of the gut, stomach, intestines, or an upper respiratory infections. Now we know that gut infections and upper respiratory infections are quite common in our part of the world. Obviously, we don't hear so much about GBS, uh, which is precisely the point that GBS is extremely rare. It happens when the body starts producing antibodies, our immune system starts producing antibodies to a certain protein that is present on the covering of the nerves. And this covering of the nerves, the sheath which protects the nerves, starts getting attacked by our own antibodies. And that is when we it starts with tingling of the extremities, for example, fingers, muscle weakness, but severe disease can lead to loss of motor function, meaning loss of movement. It can also lead to respiratory distress, and that's when get things get serious. So it's a fairly uncommon disease, but usually happens either following a bacterial or viral infection, or in some cases also without an infection, for example, following trauma during surgery or in pregnancy, in immunosuppression conditions, and even very rarely, very, very rarely after vaccinations. So that's the background of it. But of
Right.
course, the Pune situation is very different.
So, how is the Pune situation different in the sense that we understand from early reports that water contamination could be one of the lead causes? So, can you help us understand not only that, but also it seems to have broken out and spread out of the cluster. So, there is a problem containing it as well.
Yeah, so from a public health point of view, when a rare disease like that happens to many people, then two things immediately come to mind. One is that it is being transmitted very efficiently. And the second is that there are lots of people who are affected. They may not be those who are seen in hospitals, but there are lots that are infected. So let's look at the water angle.
Hmm.
From the reports that I have seen, uh, about 40% of water samples have come positive for a bacterium called Campylobacter jejuni. This is the most common cause of GBS. So, for example, globally, about 30% of GBS cases can be tracked to C. jejuni infection. So it effectively happens after this bacterial infection. And what this bacterial infection does is that it causes, you know, gut problems, diarrhea, fever, things like that. So, if 40% cases in Pune are coming positive uh, for C. jejuni, it's telling me that and it is so widespread, it's telling me that it is water contamination largely, which is responsible for that. We also have seen reports where people have found high coliform counts, meaning E. coli, in water samples across Pune.
Mm.
When there is high E. coli in water, it is usually due to either sewage or fecal contamination of water. So at some point, drinking water supplies are getting contaminated with sewage or some kind of contamination, which has the bacterium in it. And when people are consuming it, they are coming down with the infection.
Right.
Most people would have had diarrhea, and it's such a common thing in our setting that people usually don't pay attention to it.
Mm.
But the moment you say that there are about 100 cases of GBS in Pune, that tells me that there are possibly about 100,000 or a lakh cases of C. jejuni infection. Um, because I say this because only 1 in 1,000 people who get C. jejuni infection actually show symptoms of GBS. So the infection is far more widespread. And when you have about a lakh of people
Mm.
uh, having the infection due to a faulty drinking water system,
Mm.
you are getting 100 cases of GBS. I think that's the simplest explanation to it.
Because we're talking about contaminated water, ours is a country where, things like cholera, for example, we have spent
Yes.
decades fighting, um, something like cholera. And somehow we still find ourselves with GBS linked to water contamination. Just for our audiences to understand, those people who do use RO systems or any kind of water purifying systems, would you say they would be safer against GBS than, say, those who are receiving water from tankers or directly from the municipal corporation?
Yes, I would say you would be a bit safer. But remember, all these water purification systems uh, are ineffective if you don't change the cartridge on time. And
Yeah.
so, in many places, you will see that there is a water purification system next to a cooler, for example, in
Hmm.
schools particularly. But you never know when it was serviced, when the cartridges were changed and all that. So it might just give you a false sense of security. So, yes, it will help provided it's taken care of properly.
Hmm.
For the rest of the people who cannot afford a water purifying system, it is the responsibility of public health authorities of municipalities to chlorinate water
Hmm.
and to routinely check water for coliform counts. If they're not doing that, they're shirking their responsibility.
Yeah.
So, what can the rest of us do at home? It's very simple. You just boil your water before you drink it. Uh,
Hmm.
I know it takes an investment in fuel if you have to boil all the water that you drink. But believe me, boiling water is the safest way of preventing a lot of gastrointestinal infections.
What about home RO systems and also canned water? Are those, you would say, bottled water? And home RO systems, would they
Well,
be?
bottled water, yeah, bottled water again is not a solution to this. First of all, everyone cannot afford bottled water.
Absolutely, yeah, yeah.
Uh, and, again, it gives you a false sense of security. You're relying on somebody else to have ensured that your water is good to drink.
Mm.
Um, so, especially in, situations like this, when there is an outbreak in a city, I would say the safest way is just boil your water and cool it
Mm.
down before you drink it. It's the simplest.
Obviously, whenever such outbreaks happen, we do look back at recent incidents, and with GBS there have been global incidents. For example, Peru has from time to time, 2019, as recent as 2023, when there was a state of emergency that was declared for a few days. What kind of learnings do we get from Peru, or were they completely different situations compared to ours?
As far as I remember, Peru also, it was a water issue. Whenever there are very high numbers of cases, you can be rest assured that it is water, because that's a common source that everyone uses. It's very, very difficult to us to think that there is some other way of transmission. It's not an airborne infection.
Hmm.
It's an
Hmm.
infection that you ingest. Uh,
Right. We have to
um,
consume that water,
yeah,
and therefore,
exactly. And the point is that it's not what you and I learned from Peru. It is what public health authorities learned from Peru, and whether they were awake to it, and whether they applied it in our own setting. And clearly not. Clearly
yeah.
not. Uh,
Well, now we hear that, of course, there's a team from the WHO here working with the Pune health workers, training them, but also trying to gather data and information about this outbreak. As worrying as it sounds, Dr. Jameel, how do we contain this situation? Because, as I mentioned earlier, apparently it's spread out of the cluster. There are some sporadic cases outside of Maharashtra which are cropping up. But if it's not linked to the same water, contaminated water source, it's not airborne. So obviously there is an easier way to contain it if we just act on the source of the water.
well, chlorinate the water.
Yeah.
Chlorine will kill the bug, and you know that should take care of the infection part. If the water, if drinking water is already contaminated, I mean, add excess chlorine to it.
Right.
Uh, but this has to be done at a point of distribution. It is not something that individuals can do at home.
Mm.
Individuals at home should really boil their water.
Hmm.
Yeah.
Right. So I was reading somewhere, one of the US studies, that the first symptoms of GBS actually show itself several months before before you actually feel, at least some of the patients actually feel the symptoms or show the symptoms. The first feeling of it, or rather the infection of it, would have happened 6 months prior or a few months prior. How do we kind of, as common people, how do we keep a track on these symptoms? And would you say that when is the time when one starts panicking, when the obviously oxygen levels and need for a ventilator being one of them, but what would you say we should keep an eye out for?
Well, the severe conditions come much, much later, and they're rare. You
Hmm.
know, I'm not a neurologist, so please don't take what I say as clinical opinion. Uh,
Hmm.
from what I have read, it usually starts with tingling of the toes. So it starts from the bottom and moves up. Now, there could be many things that cause tingling of the toes.
Yeah.
Uh, every time your toe tingles, you should not panic that it's an early symptom of GBS, right? I Let me relate to you a GBS case that I have seen myself. Uh, a friend and colleague in 2023 had been traveling quite a bit, and he was in Turkey at that time, and he noticed that his toes are tingling, and he's feeling some weakness in his lower limbs. He immediately consulted doctors there who suspected it could be the start of GBS. They booked a flight and they came to India right away, and straight from the airport went to Max and got admitted. And sure enough, he was diagnosed with GBS. He lost all motor function. He was on bed for a couple of weeks, but thankfully he got there in time and he was treated, and he is perfectly fine now. So yes, some early realization is useful, but I don't think everyone can do it. And a lot of the early symptoms are so non-specific that
Yeah.
it becomes very difficult for a common person to really understand this. But if we are in a situation in a country where there are a lot of gut infections, where there are a lot of upper respiratory infections, physicians certainly need to be trained into recognizing GBS
Right.
and recognizing it in time. From what I have read, it's not something that happens very quickly. Usually, a few weeks after an infection episode, you start having that. Now, again, it's very difficult for us to keep track that, 4 weeks back, I had a slight flu, and today my toes are tingling. So, is it GBS? It's very, very difficult for us to keep track. But even if people get there, get to hospitals on time, get to meet doctors on time, and the doctors recognize this as a problem, then
Correct.
I think we shouldn't worry too much about it.
Obviously, I mean, this does create quite a bit of confusion in the mind and panic, at least for the people who are in the particular city right now. Of course, Pune being one of them. Um, Even with GBS, I think there are the groups who are again more vulnerable or more at risk. In this case, children and senior citizens. Again,
Yes,
I'm
yes.
assuming people with comorbidities obviously are always more at risk. Any thoughts on that, because they are always the more vulnerable groups.
Well, you said it yourself. It's the same. GBS can happen to anyone, but people who are more prone to it are usually young children or people above 60. People who have some sort of immunosuppression. Maybe somebody is on cancer therapy and is immunosuppressed. Uh, I have not been able to find a link between diabetes and GBS, but I do know that diabetes lowers your ability to respond to certain infections, so your immune system is compromised. So it is possible, and India is the world's capital of diabetes, as you know. Uh, Pregnancy is also an immunosuppressive condition because you don't want the mother to be rejecting the fetus, and therefore, naturally, it's an immunosuppressive condition. So, yes, these are the categories of people who would be more prone. But GBS has also been seen more in men than in women. So, for every 100 men, the global prevalence of GBS in women is about 85, 86. So, yeah.
Um, Dr. Jameel, as with most outbreaks, especially post COVID, the first question that comes to our mind is how medically prepared are we, especially since many of the confirmed patients have needed to be on ventilators. Do you feel that as a country we are prepared?
I think the important thing is for us to recognize this quickly, and not just lay people, but doctors to recognize if they see a patient with possibly early symptoms of GBS. And that's why I said earlier that doctors need to be sensitized to this. General physicians need to be sensitized to this. Uh, you don't have to be a neurologist to be able to identify it. Ventilator support comes quite late. So if we are able to catch it early, we should be able to intervene early. So ventilator support is GBS grade 5. Before that, generally people lose motor functions. And that's exactly what happened in the case of my friend whose case I talked about earlier.
Mm.
So yes, once one gets to the ventilator part, then it becomes serious. And after COVID, we do have better facilities, better emergency facilities in hospitals. What we also have in hospitals post COVID is that oxygen is available locally at site, which is required for ventilator support.
Right.
Earlier, even big hospitals depended upon oxygen cylinders that somebody brought from somewhere. But that's not
Yeah.
the case anymore. Hospitals of a certain size are mandated to have oxygen available, plants available on site. So that's a very good thing that has happened.
Mm. Mm.
So I think infrastructure has improved, hospital infrastructure has improved, but unfortunately, our public health infrastructure hasn't improved. And many of these things can be solved at a public health level before people actually get to the hospital.
Right.
So there has to be more emphasis on the public health side of it instead of the intervention side of it. I mean, of course, you should be prepared to intervene,
Mm.
but there are many of these problems that can be sorted out without people even getting to the hospital. And that's why we must really focus on public health, and that's our weak side.
Right. Also, I mean, I think one of the, and we're coming towards the end of our discussion. One of the important aspects, that, as you said, is the general physician being able to keep an eye out for GBS, correctly diagnose it at an early stage. You don't need a
Yeah.
neurologist. But are there any tests which ideally would show something like this? I mean, what are those tests that one should keep in mind?
Well, it's mostly symptoms to begin with.
Okay.
Then there are advanced tests. So since the disease has affects the nerves, uh, there are nerve conduction tests. So, for example, you test how quickly a signal travels from one end of the nerve to the other. And neurologists can do these tests, but these are specialized tests, nerve conduction tests. Mostly GBS is diagnosed based on symptoms. And that's
Right.
why uh, a general physician should also be aware of the symptoms and should be aware of diagnosing it.
Right. Dr. Jamil, your parting words, of course, you mentioned how public health infrastructure is what we need to focus on. Your parting words on how to prevent, contain, and obviously make sure that there are no future incidents like this. Your parting words for that.
Provide people with clean drinking water and clean air, and a lot of the problems of disease in the country will reduce. It's easier said than done, but unless there is political will, unless
Mm,
there is public will, it will never happen.
absolutely.
We worry about this bad air in Delhi and other parts of the country
Mm.
for 1 month in a year, and then we forget about it.
Yeah,
Everyone forgets about it. But the amount of damage that it is doing to children who are growing up in that bad air is immense. Just pay attention to providing clean drinking water and clean air to people. A lot of these problems will sort themselves out.
absolutely. Thank you again for your time. Really benefited from your insights and perspective as well. Thank you for joining us on the Crux, Dr. Jameel.
Thank you very much.
All right, so here are our takeaways, key takeaways from this discussion. Obviously, the situation in Pune is quite worrying, mainly because the numbers are increasing, and at the same time, we understand that GBS has kind of breached the clusters. The most important thing right now would be to ensure that the water is chlorinated immediately and at distribution point. At home, what can we do? We can take great care, especially with water. Definitely boil your water. If you're using an RO system, you're probably better prepared. However, the best thing would be to boil your water. On a larger level, to prevent such outbreaks, to prevent the surge, the most important thing that we can do as a country is focus on public health infrastructure. This should not be happening to us who already have decades of experience of fighting waterborne diseases like cholera. So clearly, something has gone amiss, and we find GBS that has kind of really caused a lot of havoc in Pune. Thank you for joining us on the Crux. We hope you liked this conversation and understood deep insights from our expert today. Thank you, and see you next time.